Operation Fresh Start is an initiative that's been done elsewhere in the country in a number of different trusts that have been implementing a number of evidence-based strategies to improve patient flow. And so what we've done is asked teams to come up themselves with things that they think they would like to do to make patients' experience, staff experience a whole lot better, at the same time as apply a number of different strategies that we know improves patients' flow in one go, so that if everybody's pulling in the same direction, we can hopefully achieve better flow through the organisation for both our emergency cases but also some of our patients that are having complex surgery done.
I think everybody's embraced the idea of doing this. You know, we did ask for every department to think of 5 things that they would do. And we said to them it's an opportunity to do things that they may have wanted to do for a long time, but they can trial it out, see if it works and see what doesn't work. And so everybody embraced that, and I think we've seen lots of energy right across the organisation, people wanting to do this, give things a try. On my walkabout yesterday, bearing in mind we're only a couple of days into it, people were already seeing the difference. And so some of the things that people were commenting on was, you know, they was finding it much easier to get tests done and so on. That was being processed much quicker. They were finding that doctors were in earlier, making the assessment of patients, and therefore the discharges were able to go earlier. So already, even just 2 days in, people had seen a massive improvement in the way patients were flowing through the system. And that just made everybody feel better. And I think there was a real feel-good factor when I walked around yesterday. So, you know, I hope that remains for the rest of the week, and at the end of it all we'll have learned some real important lessons about, you know, what does work and what doesn't work.
I quickly found that out of the 10 patients that I spoke to, only 3 of them actually knew what was happening next regarding tests, procedures or investigations, and only 1 of them had an actual discharge date. So that was a bit of a shock to me. They really liked the welcome cards. They were very keen to start using those, and the ward was very receptive to them as well. We also identified that on that particular ward, TTOs were an issue, and actually no patients ever got discharged before 12 o'clock because of this problem. Senior doctors always authorised the TTOs, and there was never the opportunity to write them any earlier. So consequently we identified that was slowing down the patient flow through that particular ward.
For Operation Fresh Start, we've had a 24-hour consultant presence within the department, both in the emergency department and on the medical assessment unit. What that has meant is that we've had an increased consultant presence, so we're having quicker decisions being made, and we're also being able to work 24/7 to make sure the patients have the right decision made and are moved to the right areas within the trust. As part of that, we've also increased our cover overall of senior doctors, and we've ensured that we've got our full complement of nursing staff as well, and supplemented some of the nursing rotas so that we're able to support the flow of patients at our busiest times. We've also introduced a senior triage for all points of access for minors and for majors, and what that has meant is that since doing that, we've had pretty much a 0 waiting time in the emergency department.
We have had really good feedback. On any given day, we do turn around, or we aim to turn around all discharges if they come down to the pharmacy within 2 hours. We normally run at around 80 minutes. For this week, we've been constantly under the hour. We've really been sort of 50 minutes the last 2 days, and up until this point today, when a discharge has come down to pharmacy, we've been turning that around within half an hour, and that's obviously, you know, really good. I mean,
normally there's a bit of a delay waiting for your CT scan, but to now we're scanning the same day service, which is what we would ideally like to continue with.
The AMAU have actually had a nurse that actually does transfers to the ward, which is very good, because basically the nurse that's actually looking after the patients in the room can actually deal with their issues and not being taken away during telephone handovers and things. So obviously the nurse comes with the porter, takes the patient to the ward, actually does the handover face to face with the nurse on the ward, with the patient on the ward, so they can see the patient, what the status is and things like this as well.